COVID-19 Delta variant is likely to peak in Kenya in mid-July, sparking a fourth wave of infections in the country. Well, that's according to a brief by the country's health ministry. The first cases of the variant in Kenya are currently driving a surge in infections in the western region of the country, forcing authorities to put in place stringent measures to contain its spread. This even as Kenya struggles to vaccinate its population due to lack of vaccines. Healthcare facilities in Western Kenya are overwhelmed, even as the numbers of those needing medical care continue to rise. A modelling forecast from the Kenya Medical Research Institute and the Ministry of Health notes that the Delta variant is now gaining dominance over the Alpha variant, which a peak expected in mid-July this year. By Monday, Kenya had only vaccinated less than 2% of its population against COVID-19. For more on Kenya's response to COVID-19 pandemic and the country's vaccination program, we are now joined by Dr. Davji Bhimji Atellah, the National Secretary General of the Kenya Medical Practitioners and Dentists Union. Dr. Atellah, very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Thank you.
Now, what gives rise to fears that this strain will spark a catastrophic third wave in just a matter of weeks?
Yeah, that's quite true, because we are looking at the western region of the country. In the last, I think, 1 month, there's been quite a number of big surge. This is explained by the number of hospitalization and the number of deaths that have been seen in the Lake region. That is the 13 counties that surround the Lake Victoria region. So this is attributed to the first Delta variant that was seen in the region of Kisumu. And therefore, we actually see that if there are no stringent measures that are taken, the fourth wave is likely to occur in July or towards the end of this particular month. This also is because of the low vaccine rate that has been in the country, because we in the last 6 months, it's about 1.7% of the adult population that has been vaccinated. This is quite a low number. And there has also been a shortage of vaccines in the country. So we only expect that this can improve if the promise that was given last week, that is that there will be a bigger number that will be vaccinated by December, and about 100% of the entire population by December next year. So if vaccine rollout really takes place strongly, then we expect to have a bit more to combat the spread, which is currently really very high.
So how quickly did the government act in terms of trying to stem the variant from spreading nationwide upon detection?
First action that the government took was to actually bring about to put half-day curfews, whereby there is 7 p.m. curfew to 4 a.m. curfew. But I guess I think also the government is contributed to the occurrence of the spread, because there were a bit of a number of political rallies that took place in the Lake region and even in the parts of the Rift Valley. So these political gatherings did not really take measures that would prevent the spread of the COVID. There was no social distance. There was no use of masks, and even the people that were not really taking the measures that precautions that were needed to be taken. We've seen, based on the political environment that we have currently, there's still more of rallies that people are attending in different parts of the country. So I think it's government activities by the politicians that is even causing the increase in the COVID in the country generally.
So just going back and analysing the data, I mean, in terms of the infection rates, do you think these curfews and the imposition of restrictions are working?
To some extent, a little bit, but I don't think that works much, because we look at into the Lake region, and when you look at the percentages that the government is reporting, the Ministry of Health, they talk about 9% positivity rate. But when you look at the numbers that are being tested, is very low, at about 2,000. But in reality, if you go to the hospitals that are in different overwhelmed, there's the more people that have been hospitalized, actually more deaths that are occurring every day. So the picture that is given by the data that is given by the Ministry of Health does not really reflect with the actual numbers that are on the ground.
Well, President Uhuru Kenyatta announced plans to build a fill and finish vaccine facility in the medium term and later set up a human vaccine hub. So are we on the right path in terms of ensuring that Kenya achieves herd immunity within a short space of time?
The one thing that I would commend the president on is him coming out after the unions, the civil societies and different organizations advocating and demanding for vaccine for the entire population. Initially, there was a plan to roll out vaccine over three phases. That is 30% by 2023. But after a lot of advocacy, a lot of noise, and a lot of pressure from different groups, including the unions, the last address that the president gave was that there was a plan to vaccinate up to 10 million by December and up to entire adult population by next year. It's a very good plan, but then the problem that we have, just like all African countries, is the implementation of the framework of that particular plan. If it is done, then that will really reduce the spread and actually combat the virus. But if it's just a plan that is not implemented, then we don't see much change that will take place.
Yeah, in terms of meeting that target, where are you in terms of ensuring that about 10 million Kenyans are vaccinated? Are there enough vaccination sites? Are the facilities better capacitated to deal with such a huge number of people waiting to be vaccinated?
So today, there's 1.4 million Kenyans that have been vaccinated. That represents 0.7% of the total population and 1.7% of the entire population. So generally, there is need to have the vaccine in a big number that comes. If you look at the capacity, there's a big shortage of healthcare workers in the country that are employed by the government. So it will require the government to employ more doctors, to employ more nurses, to employ more pharmacists, to employ more clinical officers to ensure that if and when the vaccine is available, there's rollout and there's an adequate vaccination centers in the country.
Well, some countries are seeing surges of COVID-19 infections, partly because of people's attitudes. It could have something to do with COVID-19 fatigue. So are you seeing that in Kenya? What is your analysis and observation in terms of people's attitude towards this virus?
I think people's attitude plays a great role in the spread of the COVID. Because the one, as I said earlier, these political gatherings that are continuing despite the existence of the Delta virus, which spread much faster than the Alpha and the previous strains. Then the other aspect is that people get tired of the measures that have been put in place, like using the mask every day, like social gathering, like also even social distancing, even in the vehicles. People get tired of this, but then the vaccine does not get, the virus does not get tired. So in that process, the change of attitude and the reluctance of people to take the measures also lead or maybe contribute to the increased spread of the virus.
Well, some of the reasons are quite understandable in terms of the economy. I mean, some people can't afford to stay at home or scale down on their businesses or on their livelihoods simply because of trying to curb the spread of this virus. Would you agree?
That's quite true. I mean, if you look at different communities of different people living in the much more poor places in the slums, in the urban areas, they may not sustain to live and to have short hours of working based on the types of jobs they're doing and based on the incomes that they earn. But ideally, I think the government needs to really take that into consideration, and that's why we have been advocating that there's need to have the entire population vaccinated, because that will be a sure way to ensure that the economy actually is reopened and people are able to go and do their own daily lives and meet the daily breads.
So is the Kenyan government also has an issue with regards to the brand of vaccine? I mean, some other people are making an issue out of the Johnson & Johnson vaccine or the Pfizer vaccine. Is the government looking into sticking to one particular brand of vaccine?
The first vaccine that you've been getting as a country is the AstraZeneca vaccine. I think every person that was able to get it received it freely and did not have any prejudice over it. But according to the report from the Ministry of Health, the next dose of vaccine that is coming is going to be the Johnson & Johnson vaccine. And this is because it's a single-dose vaccine and there's a need to meet a bigger percentage within the shortest period of time possible. So probably that's why they're going to Johnson & Johnson vaccine. But most of the experts and us that have been advocating for vaccines, we don't see any differences between having the AstraZeneca or the Johnson & Johnson. And that's why we have encouraged everybody to actually take the vaccines. But the rollout of the next vaccines could be different from what was there initially. We're expecting Johnson & Johnson vaccine.
All right. And I think we've come a long way as African countries in terms of communication, in terms of communicating such vital information around COVID-19. So what's your thoughts with regards to how Kenya or how well Kenya handles the communication of such information and how it plays a role in terms of rubbishing such myths associated with COVID-19?
Communication has been actually vibrant. We've seen the Ministry of Health giving updates in terms of the number of vaccinated every day on their websites and even on the TV. We've seen the daily numbers of those who have been tested and the number of positivity rates and even the general statistics regarding COVID. We are sure that it's not the exact reflection of what is happening, because if they record 9%, we're sure that based on the testing, it could be twofolds or threefolds. But the fact that the information regarding COVID is available via the USSD messages, via the WhatsApp messages, on Facebook and on the websites, it's a good thing because it demystifies the virus and makes people aware of the measures they need to take. So in terms of communication, there's a better role that has been played over the period in the country.
All right, Dr. Atellah, thank you so much for joining us this evening.
Thank you.
All right, that was Dr. Davji Bhimji Atellah, the National Secretary General of the Kenya Medical Practitioners and Dentists Union. This is the Globe on SABC News. Let's take a quick break.